going to tell you now all about the Barbados Physical Therapy Association, and they're going to be hosting a stroke symposium. So joining us to talk more about it is Dr. Melissa Walcott-Pusey, Activities Coordinator, and Dr. Stacey Boyce, who is President, both with the Barbados Physical Therapy Association. Good morning and welcome.
Good morning.
And they're wearing their shirts. You know, I'm not matching today, but they're going to bring us up to speed on everything that is happening. I'll start with you, Madam President. Talk to us a little bit about the association before we delve into exactly what you'll be doing with the seminar.
Okay, so the Barbados Physical Therapy Association, as the name suggests, we are all the members of the association who are in Barbados are a part of the association, and our goal, our mission is to educate and empower the public, improve our health and our wellness, and that is where the symposium was birthed.
All right, talk to me more about this particular symposium and why you're stressing on or focusing on stroke.
Well, we have quite a number of strokes in Barbados. It's over, I think, about 700 a year. And unfortunately, stroke happens with everybody in every age group. So what we're trying to do is inform people that, you know, it's no longer a disease that only happens to older people. It happens in any age group. And there's help out there. Once you've had this stroke, we want you to be able to figure out how to get yourself back to living the best life possible. And physiotherapy are a very big part of that. We're also incorporating other members of the team that work to get you better. So we're having a doctor, we're having an occupational therapist, we're also having, Stacey, help me from forgetting anybody.
Okay, so we're having a doctor, we're having physiotherapy, we're having nursing, pharmacy, dietitian, we're involving the Heart and Stroke Foundation, the Barbados National Registry, the QEH community health workers, so the entire body of people that manage strokes and who can give support once you've had a stroke.
All right, so a lot of the times we look at physical therapy as something that only comes into play after events like this, but I know there's a place for you even before in
Yes.
just care and taking care of ourselves as well. So I certainly hope that's something that will be explored too. But why did you think it was important, Dr. Melissa, to be able to bring all of these people together to share more about what you do, what they do, and how they all complement each other to bring people back to health?
Because taking care of a stroke patient is not a one-man team, right? A stroke happens very quickly, but rehabilitation takes a long time. So we do need people to help you, people to support you, and we want people to know that there are persons out there who can provide this care. We work as a team. We know if you come to physio and you have a problem, we'll refer you on. We'll make sure that you're getting the best care and helping you to get better as quickly as possible.
And I know from personal experience where a relative, once they get home, it's kind of like,
It's hard.
where do you
Different
go?
story, yes.
So it's really important that people get the information they know, especially with the high incidence of non-communicable diseases in Barbados. I would imagine that's what increases the chances or the numbers
Definitely.
that we're seeing with strokes. Is there registration for being a part of this seminar?
There's no registration. You can come out and be a part of the symposium. If you have any queries, you can go to our website, www.bdospta.com. You can visit our Instagram page, BPTA_246, or you can call 253-1191 if you have any queries. And like you rightfully said, NCDs are a very big part of who we are now. And as an association, we want to get in there with prevention because, as we always say, prevention is better than cure. And if we can get persons to understand their NCDs, manage their NCDs, and avoid strokes, which can lead to severe disability. And that's why we have really focused in on strokes, because the extent of time for recovery can sometimes go past a year or maybe longer. It's very debilitating, it's life-changing, and that is why we really chose to focus in on stroke prevention and its management.
All right, let's talk a little bit about the time for the symposium and what time people should be able to get there to be a part of it.
It starts at 9, and we'll have presenters all through, and we're supposed to be finished by about midday. All right.
So it's the morning session.
Yes.
It's the morning session.
All right, and this is coming up on
2 Fridays from now. Sorry.
Okay, so we still have a little time to be able
Right.
to make some time to head on out to the symposium. So it's June 14th at the NUPW
PW
headquarters.
headquarters.
So, you know, ample parking, good space. You don't have to worry about all of that. But I think it's really important, and it's timely as well.
Emily.
You know.
And we're also gearing towards the caregivers as well, because they're the ones who need support, not only the people who have had the stroke, but those who have to look after them need to be able to know how to help get them out of bed, what to give them to eat. So we're incorporating a little bit of that into it as well. So there'll be something for everybody.
That's interesting. So delve a little deeper into the shape the presentations will take. It will be physical and hands-on or demonstrative.
Yes, the presentations are going to be very interactive. Our focus is we want it to be very patient-centered so that when persons leave, they're empowered, they leave with information so that they can make the changes. Also, we will have booths set up. You can speak to the professionals after if you haven't gotten your information from the stage or you weren't able to ask questions at that particular point. There will be booths around so that you can go around and speak to different professionals after to get more information. We want it to be very interactive. You can come out, ask your questions because it is about you. We want you to leave with information so that you can make the changes for your health. So,
All right, what would you say is a big misconception about physical therapy? As I mentioned, a lot of people think, oh, it's only kind of aftercare. And I would imagine you're working to dispel this or for major things as opposed to maybe mitigating some smaller things that can become bigger things as well. I know for athletes and people who are very active, they have a very strong relationship with you. But for those of us who maybe aren't in those particular fields, usually when you engage with a physical therapist, it is after some major event.
There's a lot of things that we can do for wellness as well. A lot of people, like let's go with the older population, they'll say to you, I can't get down to the ground, and they think that is acceptable. But if something happens and you fall, then you're in trouble. So when you start seeing things like that, the physical therapist can help you learn to get up from the ground. We can help you maintain those knees and keep them strong so we don't end up having to have, you know, a lot of knee pain. There's a lot of wellness aspect that we take care of as well.
I saw you nodding in agreement.
prevention, like I said, is better than cure. And even as it relates to the stroke symposium and NCDs, there are stop signs before you can get to a stroke. So if you can get your exercise in, if you can come to your physiotherapist, you get your exercise in, you get your information, you can avoid a stroke. You can get on target. So we don't just want to be there after the event, but this symposium too encourages us to prevent. So we're going to be sharing tips as well as how you can avoid certain things so that you don't have to come to us a year after because you've had a stroke.
All right, well, go follow online to find out more information. And you still have some time to be able to plan for it. It's from 9 to 12, and they've promised it's going to be very interactive, and that makes all the difference. As an aging population, as a population affected so heavily by non-communicable diseases, I think this is something that all of us should make an effort, particularly those working with or taking care of, as you mentioned, the elderly as well should come out too. So it is coming up on June 14th. I can't believe today's the last day of May. Years going by so quickly. Yeah. It's coming up on June 14th at the NUPW headquarters. As we told you, from 9 to 12. So you still have some time to prepare for it. Thank you, doctors, for coming in and sharing with us. And I hope it is truly successful.
Thank you.
Morning, morning, morning. Good morning. Good morning to you.